Hi, my name is Kenneth Davis, and I'm a volunteer at the Pareto Clinic and a student at Edward Waters College. And today I'll be talking to you about diabetes. Diabetes is a disease associated with high blood sugar. This is because of a lack of or resistance to insulin. 1 in 10 Americans are diabetic, while 1 in 8 Americans are pre-diabetic. Diabetes can be divided into type 1 and type 2 diabetes. Diabetes can be life-threatening if not taken seriously. And on top of that, other diseases or issues can appear in a diabetic as a result. Some worst case scenarios for diabetes are visual or hearing loss, amputation, or even death. Diabetes can be managed through blood sugar management, weight and lifestyle changes, insulin and or other medications, and even surgery depending on how bad the disease gets. Diabetes, as mentioned before, is broken down into type 1 and type 2 diabetes. Type 1 diabetes is a disease known for insulin deficiency. Type 2 diabetes is known for insulin resistance, but both have the result of higher blood sugar. Type 2 is more common as it makes up over 90% of cases of diabetes in adults. Type 2 diabetes usually has no symptoms. When symptoms do occur, they include more frequent urination, intense thirst, and blurry vision. Even though someone with type 2 diabetes might not experience symptoms at first, left untreated, diabetes can lead to heart attacks, strokes, kidney disease, vision problems, pain or less sensation in the hands and feet, or even the need to have fingers, toes, or other body parts amputated. When first diagnosed with type 2 diabetes, the first thing you will be recommended to do is to make lifestyle changes, such as cutting out sugary drinks and too much starch, eating a balanced diet, more physical activity, and weight loss. This can be done through a consultation with a registered dietitian or self-education. In general, a prescription to drugs like metformin are prescribed to lower blood sugar, as well as insulin for those with problems like frequent urination, thirst, or weight loss after a diagnosis. If metformin doesn't help after a few months, a second medication such as glyburide or glipizide are a possible alternative. Not only is the goal to lower blood sugar in a diabetic, but to prevent macrovascular disease. Aspirin might be prescribed as a first candidate for this goal, not to mention surgical treatment for obesity as a drastic option for diabetic patients. When diagnosed with type 2 diabetes or even pre-diabetes, self-education is a good place to start. A website made by the American Diabetes Association is a good resource to learn more about nutrition and recipes for diabetics as well as meal planning. A diabetic is tested for and expected to manage the ABCs of diabetes control: glycated hemoglobin or A1C, blood pressure, and LDL cholesterol. A1C levels measure your average blood sugar over a period of 2 to 3 months. A1C levels of 5.7 to 6.4% can mean a risk for diabetes, while A1C levels greater than or equal to 6.5 indicate diabetes. And a patient who already has diabetes, the target A1C levels for patients might be less than 7 or less than 8, depending on the individual. The fasting blood glucose test is another test which gives a snapshot of blood sugar. 100 to 125 is the goal of blood sugar for a patient at risk for diabetes, while levels above 126 indicate diabetes. To help get A1C levels below 7%, fasting blood glucose levels should be in the range of 80 to 130, while self-monitoring blood sugar levels is more important in type 1 diabetes. Self-monitoring blood sugar in type 2 diabetics can also be useful for patients who take medications that can cause low blood sugar and or need to be adjusted based on immediate sugar levels. Here at the Pareto Clinic, we can help you monitor your blood sugar and educate you on the condition and also enable you to have the best possible health outcomes. So come down to the Pareto Clinic, where we like to say faith, leadership, courage, and wisdom leads to success.